Good morning, everyone, and welcome to the Veterans Mental Health Conference hosted by King's College London. This is our third session today, and today we're going to be focusing on veterans, families, and COVID-19. I'm afraid there's no escape. For those of you that don't know me, I'm Nicola Fear, Professor of Epidemiology here at King's College London, and I've got the pleasure of chairing today's session. So first of all, I'd like to thank you all for making the time to attend today. And I'd also like to thank the Forces in Mind Trust for sponsoring the conference series. Just to make you all aware, we are recording the session and it will be made available online, hopefully later on today. For anyone who needs captions, please press the close captions button and then that captions should be visible for you. And if you've got any questions, please post those in the live event Q&A. And that would be great because we're going to have a number of opportunities throughout this morning to ask our speakers and the panel some questions. How's today going to run? Well, we have the format of today is a series of presentations. As I mentioned, there should be time after each for a couple of questions. And then we're going to finish off with all the speakers available on a panel where we can take additional questions, queries, comments that the audience may have got. I'd like to start though with a short video from Steve Rice. Steve is going to talk about his experiences of seeking treatment and how he has seen support and attitudes change over time. Thank you.
Hi, my name's Steve Rice. I'm an Army veteran. I served from 2007 to 2014 as a commissioned officer in the Mercian Regiment. I was injured in Sangin in Helmand Province in 2010, and that eventually led to my discharge in 2014. I subsequently developed PTSD, which started becoming really present and visible in 2015. In terms of my treatment that I've engaged with and undertaken and received since then, I think what's impressive to note is the sort of the change and the improvement in what is, what is only a 6-year period, and that is, a very small, drop in the ocean if you consider the times that the NHS has been up and running. So the treatment has massively improved, and certainly if I look at the difference between what I saw in 2015, 17, 18 from the NHS as to what I see now, having recently engaged with the Coventry, Warwick and West Midlands team under Dr. Dan Barnard, it's leap years ahead of where it was in a very, very short period of time. So that's really impressive to note. I do think as well the way that the NHS is using and leveraging charities to support rather than being separate is very, very impressive to note. And likewise, I think the amount of signposting that goes on is definitely worthy of comment. I think there is room for improvement. So definitely the lack of tailoring of treatment plans. I see a lot of people getting pushed towards CBT as a standard, which is fine unless you're in the kind of the moral trauma end of the PTSD spectrum. That doesn't really help, and certainly bog standard sessions of CBT aren't going to really do much in those circumstances. So a more tailored, nuanced approach would be better. The geographic disparities that exist still really crippling the kind of the message. And the kind of therefore the lack of sharing of best practice as well is unhelpful. And finally, I think the two things that go hand in hand really are the lack of intertherapy support. PTSD is not a period of spikes. It is continuous to a degree. And so in between therapies, that crucial moment when you're trying to embed what you've learned and what you've practiced, the lack of support there is actually quite damaging and harmful. And so some support and improvement in services there would be really beneficial. And actually some form of case management to make sure that all these veteran services are cohesive and kind of joined together in that respect. Tied with that, finally, is an improvement for family support, like you get with cancer, with Macmillan Trust and so forth, like you get with Alzheimer's. Actually, the families are the ones that bear the brunt. And so I think, finally, improving that family support and the education and the well-being and welfare support for caregivers would enable those things to be pulled together much more quickly and much more comprehensively.
Steve, for that really insightful and honest account of your experiences. And I think some of the points you raised about families we will touch on later on this morning. So without further ado, I'd like to introduce our first speaker this morning. We've got Dr. Marie Louise Sharp. Marie Louise is a Senior Research Associate with us at King's College London. And really since March, April last year, she's been leading the work that we've been undertaking, looking at the impact of COVID-19 on the mental health and well-being of our veterans. So I'm going to hand over to Marie Louise now. Thank you.
Are you seeing that okay, Nicola?
Yes, thank you.
Okay, great. Well, morning, everybody. Yeah, as Nicola says, we can't really get away from COVID-19 at the moment. But yeah, very happy to bring you the initial findings from our Veterans Check study. And just before I start, I just want to acknowledge our funder, the OVA, and also acknowledge the rest of the Veterans Check team. So yeah, it's not just me, it's other people as well. So thank you to the Veterans Check team, because a huge amount of work has gone into this over the last year. Yeah, so my presentation, it's preliminary unpublished findings, so please treat them with caution, but yes, you have first sight of these. So why did we want to conduct this study looking at the impact of the pandemic on the veteran community? So obviously the uncertain and unpredictable nature of COVID-19 has had a general negative impact on people's psychological and mental health. The impact is also not uniform, and studies suggesting there's a greater impact on those who are younger, women, and those with previous mental health problems. Also, there's a proportion in the veteran population that show increased risk of mental and physical health issues and barriers to seeking help. So potentially a group that might be more at risk of some of the pressures that the pandemic has brought. Also, the specific experiences of loneliness and social isolation that ex-service personnel present with, closely linked to transition and reintegration in civilian life as well. So there's different areas as to why we might be interested in the veteran group specifically. However, military personnel, they're also trained for readiness and resilience. They're also trained for strange deployments, and so whether actually that previous training actually is a good basis for potentially a COVID-19 deployment, essentially. Yes, and also finally, the OVA wanted to be able to look at this longitudinal evidence with which to make their policy and their practice decisions as well. So the study aims, we were looking at the impact of the pandemic on the health and well-being of the veteran community. From our previous cohort study, we were able to look back to veterans, what they told us in 2014 to 2016. So we can look at changes over time and really assess what impact has the pandemic had. At the same time, we also wanted to be able to compare veterans' experiences with those of the general population as well. So around, this time last year, March, April, we very rapidly put together a questionnaire and a survey for our veteran group that had previously participated in our health and wellbeing survey. So those who had participated in 2014 to 16, so our phase 3. This was an online survey that we delivered June to September of last year in 2020. And eligibility were people who had completed that previous phase, who had left the armed forces, who lived within the UK, because obviously pandemic experiences would be very different if you were living in other countries. And so, yes, recruitment emails were sent out to about 4,000 participants. And also, just to add, the survey, the way it was put together, we specifically looked at other COVID-19 surveys that were happening with the general population and with other groups, and made sure that our measures could align with their measures, so comparisons could be made. So yeah, who responded? We looked at those who we invited and who were more likely to respond, and the kind of standard things that are quite common with response rates. So people more likely to respond were older, higher educational status, officers, and more likely to be from the RAF. So we've weighted all of these statistics to account for that responder bias. And yeah, so our sample characteristics, the majority response was from male veterans, a mean age of 53 years, majority NCO, majority had served in the army, had left service more than 10 years ago. So just over half had left service more than 10 years ago. So you start to build a picture of what this veteran group look like. Majority in a relationship, majority who responded living in England, and majority employed before the pandemic. So we asked them about their COVID-19 experiences. And quite a high proportion responded that they had or they thought they had had COVID-19. However, it was those that responded definitely and probably, and a lot of people responded probably. So it's probably why that 15% is quite so high. There was a proportion, quite a high proportion, that had known someone who had died from COVID-19. We also asked about key worker status in this group, and actually found that there was quite a percentage of people who were deemed to be key workers. So 9% of this group were health and social care key workers, and 37% all of those other categories of key workers. The majority were living with their spouse or their partner. The majority did have children. And we also asked about those who had responsibility for children under the age of 18. So just over half had 1 or 2 children under the age of 18. And we asked about their childcare arrangements and whether these had to change because of the pandemic. And nearly half of them had to change childcare arrangements, as I'm sure lots listening today would have had to do as well. And again, just under half reporting that this had a negative impact on them. We also asked about caring responsibilities. So 12% identified that they already had kind of normal or usual caring responsibilities prior to the pandemic. But because of the pandemic, 18% said they had extra or new caring responsibilities. And so this is just trying to build a picture of the types of pressures that might be on the veteran community. We also asked about COVID-19 stressors. So this was a COVID-19 stressor list, and we asked, have you experienced any of these in the following month? We asked about their finances, their health, so difficulties such as accessing medication, whether you had someone close to you in hospital. And we also asked about other things. So have you had to delay major life plans or difficulties with families or other social relationships? And this COVID-19 stressor list is a list that the UCL social study also used in their general population study. So there's good comparisons that we can make with these different stressors. So from our group, the main reported stressor was boredom. So a quarter of our group reported boredom, many reporting having to change or delay major plans. Yet, and a percentage reporting difficulties with families, with their family or other social relationships. We also asked, have you experienced have there been positive changes because of the pandemic? And actually, over half of the sample reported there were some positive changes, and 7% said there were a lot of positive changes. There might be a slight bias in the asking of that question, because when you ask someone to think of something positive, generally we can all probably think of one or two things, but it also shows that there aren't just negative impacts of the COVID-19 pandemic. So we also asked about positive experiences. We also then did measures of mental health and well-being outcomes. And in our sample, for common mental disorders, there was 26% prevalence who reported experiencing common mental disorders. For hazardous drinking, 28%, and that's using the audit measure of 8+. 4% reported alcohol misuse. And then we asked also about loneliness, and this is using the UCLA 3-item measure of loneliness. And 27% of our sample reported feelings of loneliness. So how do these levels compare with previous levels? So we have data back from our phase 3 study in 2014 to 2016. With common mental health disorders, actually the prevalence of CMD remained stable, and there was no statistical significant difference between CMD reporting from prior to the pandemic and during the pandemic, so fairly stable levels there. Hazardous alcohol use actually was quite a reduction down from 49% to 28% in our Veterans Check study, and so that was a really interesting outcome. When we delved into those who were reporting common mental health disorder symptoms, even though the prevalence remains fairly similar, so 25%, 26% in Veterans Check, we looked at who within the veteran group, who of those reporting those symptoms were persistent cases, who had got better, and which of these were new individuals reporting common mental health symptoms. And just interestingly, within those statistics, there's actually quite a shift, quite a movement in that 11% remained the same compared to phase 3. There was 13% that had got better, and then there was 15% within this group who have reported new onset since phase 3. And so even though the prevalence is fairly stable, just important for healthcare providers that actually there's a new group who may be needing to access services. We then looked at what COVID-19 stresses were associated with reporting CMD. So you are more likely to report symptoms of common mental health disorders if you'd had a change in worse for employment, were responsible for 2 or more children and had to change your childcare arrangements, and if you had caring responsibilities or new caring responsibilities. Also, that whole long list of COVID-19 stresses that we asked about, all of these were associated with reporting common mental health disorders, but particularly the ones that had the most impact. So you were more likely to report common mental health disorder if you had difficulties with your health, difficulties with family or other relationships, difficulties with work or financial problems. So here we can really see pressures on families and carers. And just a kind of note of caution, cause and effect. So were these veteran groups, these veteran families, did they have kind of difficulties in family relationships pre-COVID-19 that were still difficult, or have these been exacerbated by the pandemic, or is it the pandemic causing difficulties? So it's a little hard in terms of dealing with cause and effect. We also looked at what stresses were associated with reporting loneliness. So you were more likely to report loneliness if you were a health or social care key worker, if you lived alone, if you had children and were responsible for 1 or 2 or more children, and if you had caring responsibilities. And again, more likely to report loneliness if you reported difficulties with family and other relationships, health, and experiencing boredom. So again, we see here pressures on families and carers. And interestingly, yes, that reporting more likely to report loneliness if you're a health or social care key worker. We also looked at what COVID-19 stressors were associated with hazardous drinking. So you are more likely to report hazardous drinking if you reported difficulties with your health, again, difficulties with family or other relationships, and experiencing boredom, which probably makes sense. And just to note, we also controlled for previous mental health and alcohol use, and so these associations still remained after controlling for previous mental health and alcohol use, which does suggest a COVID-19 impact here. So just to put this into context, where does the Veterans Check study sit compared to other studies? So actually similar levels of common mental health disorders found in Veterans Check compared to general population studies. So the UCL study and the UK Household Longitudinal Survey, very similar levels here of different mental health measures of common mental health disorders. And also just note here, so our next presenter is Professor Murphy, who is going to talk about the combat stress study. And just to their measure compared is much higher in terms of their CMD prevalence at 77%. But obviously these are quite different samples. So the Veterans Check sample is essentially a community sample, as are these general population samples. And combat stress is a kind of help-seeking, treatment-seeking clinical group. So obviously that's probably what accounts for those differences. But yes, so Professor Murphy will talk more about that in the second presentation. So all of these levels have risen compared to pre-pandemic levels for reporting common mental health disorders. Interestingly, in general population studies, there are, in the UK Household Longitudinal Survey, for example, there's a 9% rise reported in common mental health disorders and depression. And the Veterans Check hasn't seen rises like that. We looked at literature reporting on family relationships, and in the US and UK, there are other studies saying, yes, COVID-19 is really putting pressures on family relationships, parenting, those with caring responsibilities. And again, you know, we can all understand the importance of social networks and how these were so disrupted and still disrupted during the pandemic. In terms of loneliness, comparing this to the general population, we actually found very similar levels of reporting loneliness in the Veterans Check study compared to the UK Household Longitudinal Survey. And actually the UCL study reports much higher levels of loneliness. And why might there be these differences? So the two general population studies, they were conducted earlier in the pandemic when there was more restrictions, so maybe people were feeling lonelier at that point. In our Veterans Check study sample, actually the majority have a spouse or a partner, which is protective of loneliness. However, yes, just noting again that loneliness felt by carers, parents, carers, and health and social care key workers, but this pattern of pressures on families and social networks and the usual support that you might have had through families and friends, obviously not being there in the same way during the pandemic. The alcohol finding, so really interestingly that we found a reduction in hazardous alcohol use, which is great. But how does this compare to the general population? So when we take a measure on the Audit C using a 5+ cutoff, comparing high risk drinking, so the Veterans Check group are at 49% and the general population is still down at 38%, even though in the general population they have experienced kind of increases in high risk drinking. So it's good news that the veteran group have been drinking less during the pandemic, but just to put it into context, they're still drinking at high levels compared to the general population. So why might the veteran group have reduced their drinking? Well, obviously, social drinking, in pubs and restaurants, maybe that is one explanation. Have there also been reduction attempts in high-risk drinkers? So that idea during lockdown, I think people might have gone either way of, I'm going to get really, really healthy, or I might be drinking more than usual. And I think there could be that actually in the veteran group, there's been reduction attempts in those high-risk drinkers. And then also there were very few COVID-19 stressors associated with alcohol use. And so we also think that this actually isn't being used as a coping mechanism in the veteran group during the pandemic. So what's all the implications of this? Actually, veterans are experiencing the pandemic in very similar ways to the general population, and in some ways, actually might be quite resilient in some of their responses. The reduction in drinking is really positive. Will it continue as different phases of the pandemic happen and opening up again? So that's a question into the future. And obviously for a minority of veterans who do need mental health support, healthcare services will need to focus on novel ways to deliver their therapies and support. And actually that's already happening in many services as well. And then just a thought for kind of stakeholders delivering services for the veteran community. So what support can be offered to veterans' families, to health and social care workers and those with caring responsibilities to really support those groups that are feeling the impact and the pressures right now? So our next steps. Yes, so we have planned a phase 4 wave of data collection of our cohort study, and we'll be able to follow up where the veterans who participated in Veterans Check, what happens next, and we'll be able to see their journey and indeed whether some of those reductions in alcohol use have been maintained. Yeah, and just to say thank you to the Veterans Check team and to our funder, the OVA.
Thank you, Marie Louise. Lots of great information there. So thank you for sharing that with us, and completely understand that these are preliminary results and so need to be treated with a little bit of caution. So thank you for sharing. We've had some great questions, and thank you for the audience for putting their questions in the chat. We've got time at least for one and maybe two, depending on depending on the length of your answer. One question that came up was particularly around women, and were there anything specific that was emerging from the results of the study thus far, particularly around caring responsibilities?
Yeah, so I think just to reiterate, looking at the impact on families and carers, and particularly the childcare issues of the pandemic. And that seemed to come out time and again in terms of the impact on their mental health and feelings of loneliness. And, I don't necessarily think that's, hugely different perhaps from how people in the general population might have experienced it, but I think nevertheless it's something that people can focus on within these groups, and particularly families with young children as well.
Thank you. And then just one final quick question. You talked a lot about alcohol and alcohol misuse, and some potentially encouraging findings that those rates of alcohol misuse are reducing. Were any additional measures included on drug use or misuse or gambling, just thinking about the session for the conference that's coming up next week?
So we didn't ask about drug use, but we did have a short measure of gambling, which so we're still analysing data, maybe not as we speak, but yeah, there's still a lot of data to really go through. So that's something that we do have some information on.
Perfect. Thank you, Marie Louise. And I'm sure there'll be some follow-up questions in the Q&A, but thank you for now.
Thank you.
So now I'd like to introduce our second speaker this morning. This is Professor Dominic Murphy. Dominic is an academic clinical psychologist at Combat Stress, but as well as doing all his clinical work, he also leads a research department which is co-located within Combat Stress and the King's Centre for Military Health Research. Dominic is, well, you've had a kind of preview of maybe what Dominic's going to talk about this morning from Marie Louise, but Dominic's going to talk about the impact of COVID on veterans with pre-existing mental health conditions. So Dominic, over to you.
Thank you. And can you see my slides okay?
Yes, thanks.
Okay, thank you. So I think as Marie Louise has you've seen Marie Louise's presentation, this hopefully mine will dovetail quite nicely, where we were exploring the impact of COVID-19, but on veterans with pre-existing mental health difficulties. I don't want to be too repetitive, but the background to this study really was, in the early stages of the pandemic, it was tentative. There's quite a lot of evidence to suggest that the group most at risk of increased mental health difficulties were those with pre-existing mental health problems, which is quite intuitive in some ways, but particularly anxiety disorder type presentations rather than maybe some of the more mood disorders. And so that's exactly what we set out to do, was to explore that kind of impact. And this was nested within the King's study as well. So we used all the same measures, so we can make direct comparisons at some stage. And Nicola, Professor Fear, was part of this team as well. So the population we sampled, these were veterans who had engaged with combat stress in 2019. And you can see here a list of sort of inclusion criteria. So they had to have a pre-existing mental health difficulty. They had to have engaged with us at some stage. So we had that kind of evidence of pre-existing mental health difficulty. Provided consent for contact, provided a working email address, and then we randomly selected about 50% of this population, and then we collected data via a kind of 3-wave online survey. And just to let people know, I'm sure most people know who Combat Stress are, but if not, we're a mental health charity in the UK that provides treatment to veterans across the 4 different nations of the UK, and we have outpatient and residential treatments. Well, maybe not at the moment because of COVID, but we actually at the moment we're doing mainly online remote access kind of support. We had this study, it's longitudinal in a sense, but it's not prospective. So we only started collecting data after the pandemic had started, so we can't really comment on change so much. But we had 2 waves of data collection. The first we collected mainly during lockdown 1, during June 2020 last year. I kind of look at those dates, it almost feels like such a long time ago. I mean, I think, I don't know, I've done a lot of homeschooling, so maybe that's aged me a lot, but also it just feels like a long time ago, June last year now. I think lots happened. But so we conducted lockdown 1. As I said, we had around 1,100 people in our sample, and we got responses from about a quarter of them. So, some issues there potentially with response rates. This data was published last year. You can see the reference there. It's available on the King's website as well. And in wave 2, we collected data during lockdown 2, so during November last year. We only followed up those people that had taken part in wave 1, and you can see we had about just under 100 of those. That group responded to about a third, and that paper is currently under review. So a bit like Marie Louise, I'm presenting kind of preliminary, some published data, but also some preliminary data. So take it with a bit of caution. Yeah. So you can see we used all this. We used a stripped down version of the Vets Check survey, mainly because we wanted to make it a little bit quicker for veterans with pre-existing mental health difficulties to complete. And you can see here a bit of a summary. Wave 1, the demographic characteristics and military characteristics, mental health, alcohol misuse, social support, all the kind of COVID-19 outcomes and COVID-19 stresses at previously been spoken about. And then we repeated the majority of these at wave 2. Now, because we had a smaller sample, we couldn't go into so much depth of detail as in the VETS check. So we dichotomized a lot of the variables. So we would make a sort of high COVID-19 outcome group or a high COVID-19 stressors group, which you'll see when I start showing some of the results. So some of the demographics here. You can see we had, in general, there weren't many differences between those who responded and those who didn't respond, except for the responders tended to be a little bit older. So we had to weight our analyses to account for this. The vast majority were male, which is perhaps unsurprising given the population we work with. But actually, I was thinking about the question earlier about the impact on, if you think of the general public, the impact seems to be greater for women. Actually, they're underrepresented in this group, and it really limits the power we can to explore. 60% were in employment at the start of the pandemic, 67% in relationships, and nearly a quarter, so 23%, reported probable COVID-19 infections, which is, I think, higher than the 15% in the wider veteran group, and 15% reported experiencing a bereavement related to COVID-19. And I think these are really high figures. So 15% in the kind of treatment-seeking group, 18% in the wider veteran group experienced a bereavement directly related to COVID-19. I think that's something for us all to kind of pay attention to. That's higher than I would have expected. And it's higher when I looked at kind of the other studies. Now, I was trying to find colours that would work well, and I ended up finding really awful colours, so I apologise. Now, the red bar, these are the numbers of the proportion of the population that met case criteria for a range of mental health difficulties. So you can see here, the first bar is general, the common mental health difficulties, anxiety and depression, so about, I think it's 77%. The black bar, the people that reported that their symptoms were worse because of the pandemic. So again, around 70% of people who reported that their symptoms of anxiety and depression had got worse because of the pandemic. So the first thing to note is actually common mental health difficulties, the most prevalent, followed by difficulties with anger, then alcohol, and then alcohol misuse. Did I say that wrong? So followed by common mental health difficulties, then anger, then PTSD, then alcohol misuse. Now, because this isn't longitudinal, we didn't collect data we can't comment on change, but we had done a study with exactly the same methodology and same methods a few years before, and we actually got a slightly different pattern. We got PTSD being the most prevalent disorder, at around over 80%, and less so for common mental health difficulties, anger, anxiety, and alcohol problems. So there's very, very tentative evidence, because it's based on 2 different samples, but the same methodology, that in general, rates of anger, PTSD, and alcohol misuse seem to have decreased between 2017 population and 2020, the study. Very tentative though, but that rates of common mental health difficulties have increased, which sort of is what I might have expected given the findings in the general population around the impact on people with anxiety disorders. Some of the predictors now, I love a slide with lots of numbers, so I apologize. I'm trying to minimize it now in presentations, but this is showing some of the predictors of symptom severity at wave 1, our baseline. And the yellow, I'll talk it through in a bit more detail, but the yellow boxes are the ones where it's significant. These are significant predictors, and the blue boxes are where it's not significant. So if we take something like, if we take the first column, PTSD, living alone wasn't significantly associated with worse, more severe symptoms of PTSD. Yet actually, when we looked at the COVID-19 stresses, those were the highest stresses, were significantly more likely to report more severe symptoms of PTSD, common mental health difficulties, anger, and alcohol misuse. So those sort of COVID-19 stresses that are most prevalent here, which is quite intuitive in some ways. And then the higher social support, so actually the higher your social support, the better, the lower your symptoms were. Again, causality's got to be considered here, because typically having more complex mental health difficulty like PTSD is associated also with having less access to social support. But for me, the kind of takeaway home when I put my clinical hat on is right now, if we're treating people as a community, we need to be thinking quite practically about how to improve social support, for example, through things like peer support, things like that. And also a lot of practical support right now to support people with those very difficult stresses around childcare, boredom, financial problems and things like that, which may not be the focus of maybe more pure psychological interventions. So then the group that we followed up, so it's quite modest, we followed up about 100. Again, the colours I've chosen get worse and worse, but the red bar, these are cases in the wave 1, so in June last year. The black bar are cases in November, and the green bar are the self-report that symptoms have got worse. These are the group that symptoms have got worse between the waves. So you can see in general there's a bit of a reduction. So symptoms, the number of people meeting case criteria seems to have reduced. So for common mental health disorder, it seems to have come down from, in the group that we followed up, about 75% to around 65%. And you can see that's across the board. These were significant reductions, apart from for alcohol and for PTSD, where there wasn't a significant change. Now, what I haven't presented here is there was a lot of, like Marie Louise presented, there was a lot of change between the groups. So lots of people who were symptomatic at wave 1 were no longer symptomatic, and people who weren't symptomatic became symptomatic and met case criteria. So a lot of swapping around between groups. So it wasn't, which is actually what you sometimes expect, that kind of waxing and waning of, let's say, trauma symptoms, wax and wane a little bit at different times when there are different stresses. But the general message here is it seems to be a bit of reduction. It seems to be that people have been coping better, and there wasn't a deterioration. Now, again, the last time I show any numbers, like slides like this, I apologise, but these are some of the predictors of worsening health between the two waves. So this time, actually, social support wasn't so important. The better your social support, you had a slight reduction in anger, but it didn't impact on trauma, on anxiety, depression, or alcohol misuse. The biggest factor was really around these COVID-related stresses. So the group that continued to report extremely high numbers of COVID-related stresses at wave 2 in November last year was significantly more likely to have more serious PTSD and common mental health difficulties with anxiety and depression, which again just highlights, I think, the importance right now that any support we offer to veterans has to really consider these practical side and not just focus on the more kind of psychological symptoms. It has to focus a lot on the kind of more holistic support. So limitations, it's always good to consider some limitations. Relatively low response rates. When I did look at other online surveys, actually this isn't bad. Some surveys, typically get around 10–15%, so not too bad, and we were able to wait for it, but relatively low. Quite modest sample sizes here, which may limit some of the power we have. So, for example, to look at the subgroups, look at females, for example, or to other kind of subgroups. And we sampled from combat stress, which may not be representative of all help-seeking groups, though actually there was some reassurance that when we compare between other countries, there's one comparison we've done with Australians, actually extremely similar profile. So that's sort of helpful. Some of the strengths were nationally representatives. We recruited from across the kind of the 4 nations. We did definitely know that these were people with pre-existing mental health difficulties. So we knew this was clinical population, so we could have a look in that group. And we were able to collect data of quite a brief time when there's a rapidly changing kind of situation. So some of my conclusions, there's some very, very tentative evidence that mental health difficulties in this sort of more vulnerable population haven't got worse because of COVID-19. And there's a bit of evidence that between the 2 lockdowns, at least, symptoms slightly reduced. Yeah, one thing I thought about, there may be some unintended consequence of these lockdowns. If I take something like PTSD, for example, if you think about PTSD, it can be considered, there's triggers in the environment that bring back difficult memories from the past. And actually, when we're all kind of locked in our houses and we're not allowed to go out, we've got more control over our environment. And so this actually might have produced an environment which feels safer and less triggering, which might account for some of those reductions in PTSD. but which, if you turn around the other way, may mean actually in the longer term, when people, we all, hopefully, touch wood, we all start going out and mixing and socialising again. And I dare say, if I don't really want to say it, but if things ever do return slightly more to normal, it's important to kind of continue to monitor it. Just because the rate of PTSD have gone down now, I'm hopeful they'll continue to remain low. They might escalate again when actually people's control of their environment changes. And my kind of take-home message for providers is really the importance of kind of boosting social support, and that really important focus now on tackling those stresses, trying to think about that more holistic treatment. And as I kind of said, I just wanted to look and saying, you know, it is early days. We're still in the middle of this pandemic in some ways. Hopefully, you know, things are improving, but we don't know what the longer term impact is. So, you know, it's important to kind of follow this group up, see what actually happens in the longer term. I just want to acknowledge the team that kind of did this around everyone. You know, everyone's very busy. COVID was very busy. You know, last year was a very busy period. We were all very busy. And we kind of fitted the study in around all the kind of work we were doing anyway. And of course, the veterans who took time to fill out online surveys, which is never that much fun. So thank you, everyone. And if there's any questions, please do ask me now in the panel.
Thank you, Dominic, for your presentation and talking us through those results. And as someone who likes numbers, I was quite happy with your tables, but so thanks. If we've got time for a couple of questions, if that's okay with you. We've had a couple of questions around the inclusion of veterans who are either in the criminal justice system or who are homeless, and whether or not these veterans would have had the opportunity to take part in the study.
I can't answer that question because we didn't have that level of information. In theory, they would have had the opportunity to take part because the inclusion was they had to have given us consent to contact them, and they had to have a working email address. So in theory, they would, as I said, they would have the opportunity, but you know, I can't. We unfortunately don't have that data to be able to answer that. I'm sorry.
Okay, no. And forgive me if I missed it in your presentation, but did you look at all the COVID stressors together, or did you? Yeah, and I'm just wondering, was there any differential impact of some of those stressors? So say, for example, if you experience the bereavement of a close family member or friend.
So interestingly, they were predictors. So a lot of other US and Canadian studies have looked at veterans have found either suffering a bereavement or having a probable COVID diagnosis were predictors of particularly anxiety and depression. And so I was quite intrigued that we didn't find that. I mean, partly it might be because of our numbers, relatively limited power, and partly because actually, I mean, I was quite surprised by the very high prevalent rate there. I think that's something, you know, I'm sure I'd like to see a study in the general public. I'm not sure nearly 20% would have experienced a bereavement directly related to COVID. And so I think that's something that really that needs more unpicking.
Yeah, thanks, Dominic. One question that's come in from the audience is around what are the practical applications for the veteran and military community? Let me restart. What practical applications for the veteran and military communities do you foresee coming directly from your study?
Well, in the short term, I think what would be very helpful is if there's any funding stream to provide extremely practical support for people, whether it's you know, to actually right now people obviously, you know, I'm a clinical psychologist as well. Psychological therapy is helpful, but right now it seems that the importance is around there's a bit of data that suggests the importance of putting money into peer support and practical support. So social workers, for example, providing support, or you know, and that sort of focus right now could be really helpful. Longer term, you know, I think hopefully things will settle down and that won't be needed. But right now, I guess that would be my plea, that when we are working with veterans, that we're not just thinking about what's going on, you know, the psychological formulation or diagnosis. We're thinking about actually what's going on in your home life. where can we support that? Because that might give a better sort of, it might be more cost effective. It might have better returns in the short term for people, and then actually provide a more stable base for psychological support later on.
Okay, thanks. One of the outcomes that you'd looked at in your study was anger. And one of the questions that's come up in the chat is around domestic violence. Did you have any insights into that, and whether there was you were seeing a kind of COVID impact on rates of domestic violence?
Pardon me. With hindsight, I wish we had asked about domestic violence, but we didn't. I think, in a previous study we did, there was a high, and I think we asked a question in the last month, were you a victim or perpetrator in some ways, and there were pretty high rates there. And I think actually it's important. I regret not putting that measure in, to be honest, because I think that would have been helpful to have done, especially to have looked at longitudinally. I think when you forget veterans for a minute and you look at the wider population, there is emerging, slightly sad, but emerging evidence that rates of domestic violence are going up, and actually probably maybe going up higher than we know, because a lot of it might be hidden because of issues around home visits and things like that with social work. And I think I can't imagine that the veterans are any different. I think the problems faced in the general population will probably be mirrored within the veteran population. And so, yeah, I'm sorry, I can't really answer that more clearly. But I think it's definitely something we should look for, and we should definitely think about any follow-up studies should be looking at that now, because I think now's the time to see if that's how these sort of family issues and dynamics are emerging.
Thanks, Dominic. One interesting question that's come up in the chat is around whether or not the participants in the study are perhaps more likely to have an underlying condition, or I suppose greater need, and therefore more likely to take part in these studies. And I wonder if you had any insight into whether the 25% of people that were taking part in your study were substantially different on their kind of treatment seeking or underlying mental health profile.
We didn't have that data to explore at wave 1. At wave 2, we did have that data. We didn't find any health. We didn't find an impact of baseline health didn't impact on at wave 1. Didn't impact on whether you responded or not at wave 2. However, I think when we published the study, one thought we had as a team was actually, and a limitation we put in was the opposite. That it may be that people want to take part because they have more mental health difficulty, but it also could be the opposite, that people that are really struggling, actually they're less likely to take part in these sort of surveys, who are missing the most at risk. Because actually, I think I said we reduced the survey length, but it still took about 15-20 minutes, which, when everyone's very busy, people might struggle to find, particularly if they're struggling from more severe mental health difficulties. So I think it might work both ways.
Okay, thank you. And then final question, and this is, I'm taking chairperson's privileges here. You've talked about wave 1 and wave 2 of data collection. Now that we're moving into a different phase of the pandemic, are you anticipating a kind of wave 3?
Well, as also one of the co-investigators, it's a question I need to discuss, but my plan would be maybe in June, so a year on from the original wave 1 study, we could maybe follow up the 275 group, everyone who responded to wave 1, see how they're doing it sort of 12 months later. So yes, of course it does depend a bit on what happens and what's happening in the summer. Yeah. Okay, thank you very much.
Brilliant. Thanks, Dominic, and thank you for taking those questions. And I'm sure there'll be many more when we get to the Q&A panel. So thank you. So now I'd like to introduce our speakers for our third presentation. And here we have a duo, and it's my great pleasure to be able to introduce Professor Jan Walker and Dr. Gabriela Misca. And they're going to be talking about the work that they led and undertook around the independent review that was commissioned in January 2019 by the then Secretary of State for Defence, Gavin Williamson, to examine the support needs of military families. The report, Living in Our Shoes, which I'm sure many of you will have seen and read, was published in June last year. And as a result of the work that they undertook to do that and the impact of the report and the ongoing impact of that report, both Jan and Gabriela were awarded the 2021 Special Award for FIMPACT, so impact through FIMPT, through the Forces in Mind Trust, and they're very worthy recipients of that award. And I'm delighted that they can take time out of their schedules to talk to us today in more detail about the work that they undertook. So Jan and Gabriela, over to you.
Thank you very much, Nicola, and it's a great pleasure to be here with your conference. It would be wonderful if we were all together in the same room, but hopefully another year. So yes, Gabriela and I are going to do a double act today. I'm Jan Walker, and I was the lead advisor for the review with Andrew Salu MP and the lead author of the report that we're going to be talking about. And I'm going to ask Gabriela to just introduce herself briefly, and then I'll get started.
Hi, everybody. I'm Gabriela, Misca, and I worked with Jan on the Living in Our Shoes report. And just to clarify, we are not talking about the impact of COVID-19 in this particular talk, but to say that listening to the previous presentations, I would like to talk further with both Marie Louise and Dominic, because we are running a study looking at the impact of COVID-19 on families called Families Unlocked, and we actually had over 1,000 families participating, and we had a high percentage of key workers responding to our survey, which in many ways is very similar. So there might be opportunities there to do comparisons and learn further.
Okay. So I'm just going to give you a little bit of context background. We were asked today to talk about determining the priorities for support. And I guess we would say that almost everything we wrote about is a priority. But of course, one has to make some choices about what to do first and how to do it. But just to give a little bit of background, as Nicola has said, this was a commission from the Defence Secretary in January 2019. And the request was to look at the diverse needs of serving personnel and their families to see whether those needs were being met and to make recommendations for change. And we decided really very early on that this was going to be a qualitative study. We wanted to hear the voices of as many people serving in the military as possible, their partners, family members, and their children especially. So we went for a call for evidence, and we had 287 responses. And when I say responses, they were often very lengthy, very detailed exposés of what it is like to be serving in the military. And we heard from both serving people and their partners. And we visited 14 military bases during the course of the review. And in those visits, we saw a lot of what was going on, but we also talked to people from all ranks and their partners, families, and their children where that was possible. And we did most of that talking. We didn't have the chain of command with us. We were able to talk at length with families, which was excellent. We also went to 4 schools, 3 of which were ordinary state schools, 1 of which was a boarding school, a state boarding school, to actually talk to the children themselves about growing up in the military and to hear their voices. And then in addition, we had conversations with 143 stakeholders, people who are working with the military on a day-to-day basis, offering service support, and various government departments, and indeed the devolved governments of the UK as well. And while we were doing all that field work, Gabriela was conducting a national and international research review, and we'll talk a little bit about research priorities towards the end of the presentation. So having got a lot of the qualitative information from people's words, inevitably our analysis was looking thematically at what people had said to us. What were the themes that came up over and over and over again? And this particular quote from an army partner really gave us the title for the report. She said, I wish people would live in our shoes, especially those of wives and children left at home when they become single parents for months at a time, obviously when their partners go on deployment. And the second quote really highlighted some of the challenges. This was a naval family who were incredibly proud of the service and of their serving partner and the father. But they said very clearly, both partners said to us, it's been at the cost of the quality of our own relationship. And it has had an impact on our mental health and well-being and that of our children. So in other words, people were telling us that whilst they were really proud to be part of the armed forces, it came at a cost to their personal lives. So having looked at all the key themes, we began to look at the cumulative impacts and some of the disadvantage. It's quite clear that military families face the same stresses and challenges in everyday life as every family does. But there are additional challenges and there are cumulative impacts which we actually need to take note of. And I guess the very first thing that came across to all of us was the commitment to operational effectiveness and duty first. That is what people sign up for, and that is their very first priority. And we know that the armed forces families are diverse. They are often invisible if they live in our communities and not on the bases and are dispersed. They're often quite invisible to the general population. We know that the Navy, the Army and the RAF have different histories, different cultures and different ways of running their business. But at the end of the day, the challenges are shared by all the families. And these are quite clearly, as everybody I'm sure in this audience knows, long periods of separation during deployments. And we were not surprised, but we were struck to find out that very often families said they feel lonely and they feel isolated when their partner's away. There are clearly pressures on parenting when people are separated. And there was pressures on personal relationships and mental health, as our quotes showed. The other cumulative impact is the frequent move, which disrupt children's education, the careers and employment opportunities of partners. It disrupts friendships and peer support, and it disrupts the continuity in healthcare for family members. And I think what we were told over and over again by serving and non-serving personnel was, it's virtually impossible to plan family life. We can't plan family activities and create what we would like to be a stable family environment. So this balancing between the demands of the services and the demands of the family are really, really difficult. So having looked at all our evidence and analysed a lot of recorded data, we came up with several key themes, which we then wrote about in the report. And the numbers in the brackets on this slide are the numbers of recommendations that we made on these particular topics. So one of the first chapters in the report is about housing. Everybody raised the issue of the quality of service family accommodation. And I'm not going to talk about that much today because I know that that's a very well understood issue, and it is an issue that the Ministry of Defence is taking seriously and doing something about. But everybody needs a place to call home. And this group of the population have many homes during their lifetime, and that can be really quite a challenge. The largest group of concerns that people talk to us about is the impact of service life on children, particularly on children's education. And we've made 31 recommendations about how we believe that children's education can be supported better in future. The next group that we looked at was the partners who are non-serving, who have huge employment challenges if they are constantly moving around the country, and indeed for some of them around the world. And we've long gone away from the partners just trailing around their serving partner, but these people have lives of their own, and we have to think about living our family lives in the 21st century. We made a number of recommendations about the health and care of family members. I'm going to go into these in a little bit more detail in a minute. We didn't really talk very much to people who were about to leave the military, but what was clear from those who we did speak to was that in order to leave the military well, the whole family needs to be part of that final transition. And our belief is that we need to support service families right from day one, and therefore when they get to the final transition, it is a much easier thing to do. And the last few chapters in the book are about support and how well we support our service families at the moment. And we've made a number of recommendations which we think can be easily implemented. And one of the things that we focused on at the end was how we could use the Armed Forces Covenant to actually do better to support families. So that's kind of the context. And I'm just going to talk a little bit about determining the priorities now. So if we look first of all at children and young people, the things that are difficult are the frequency of school moves, 8, 10, 12 schools in a lifetime, and moving mid-year, which is incredibly disruptive to children's education. So people were learning one thing lots of times and other things not at all. We looked very much at the use of the service pupil premium, used incredibly well and supportively some places and less well others. And we also look particularly at children with special educational needs and disabilities who actually have quite a rough time moving around, being reassessed. So what are the priorities? Training teachers and people in education about the additional needs military children face. Everyone needs to be aware of them because there are schools in this country, most schools have 1 or 2 military children. They need to be understood. And particularly understanding the emotional cycle of deployment, which can be really difficult for children to navigate over and over again. We want to see the service pupil premium used consistently across the country and used appropriately to support children. We also came across a number of young carers. Young carers in the military seem to be pretty well hidden. They're not very easily spotted, and yet they endure a lot of difficulty when one of the parents is away, maybe for 6 or 9 months at a time, and they're left at home caring maybe for the other parent or a sibling or whatever. We think there needs to be service pupils champions in every local authority, and there are some excellent local authorities around the country doing great stuff, but there needs to be an understanding locally about service life. And we believe there needs to be much more detailed and much more robust research into understanding children's outcomes and choices. And again, we'll come back to that a bit later. We made one overarching priority, and that was for all of the governments of the UK to take all necessary steps to make sure that service children are not disadvantaged by service life in their education. And this actually seems to fit very well with what the Children's Commissioner announced yesterday in the Childhood Commission, that looking after children and their education must be a priority. So having looked at children, we then looked at the partners who were non-serving. And I should say that we came across a number of dual-serving families. They have their own special challenges, and there is definitely a need for more research in that area. So not just a partner, huge career disruptions, potential discrimination, and we heard horror stories of people who were applying for jobs when they moved, only to be told, oh, well, we are a bit reluctant because you're going to be moving on again in 2 years. And people telling us their CVs look like a car crash, and therefore they hated having to admit that they were a service family when they applied for a job. And one of the things that held them back is not being able to have childcare. Now, childcare is an issue for all families. But when these families are moving around a lot, they are constantly looking for more childcare, new childcare, wraparound childcare, and often there are long waiting lists, and by the time they get to the top, they're on the move again. And we also found that for SEND children, again, childcare is a problem. So what can we do about it? What are the priorities? Well, we need to raise awareness amongst employers, and the employer recognition scheme in the Covenant is a really good way of doing that. And there are some now very good examples around the country of large employers taking on the challenge of military partners. And there needs to be much greater awareness amongst employers. We do need to challenge discrimination. If you give your address as somebody living on a base and it happens to be Trafalgar Road or Waterloo Avenue or something, people guess very quickly that, oh yes, that must be a service family accommodation. We need to challenge discrimination which says, don't think we want those people working for us. So we need to encourage partnership initiatives, and there are some very good ones between the forces and employers. There needs to be more of them. And we need to take account of partner employment and children's education when decisions are being made at an operational level about mobility and posting. That's not to say that operational effectiveness has to come first. Of course it does, but sometimes the decisions may need to be tweaked in order to make it much more reasonable for families when and as they move. And we also need to know more, again, another research bit, about how the various spousal and partner support programs that are on offer, what sort of impact are they having? They certainly increase people feeling valued, but do they have an impact on retention? Because very often service people were telling us that they were going to have to leave the armed forces because their partner could not tolerate the fact that their work patterns were totally sort of shot through. Their children were suffering and they just needed to leave. So more that needs to be done for partners. When families move around, they have to find new doctors, new dentists. They have to go from one waiting list to another, and this is especially problematic for children having mental health services. And securing continuity of treatment has been a challenge for many families on moving. Now, that's a very different experience to the serving partners whose health is taken care of by Defence Medical Services wherever they happen to be. We face variations in healthcare provision between the 4 nations of the UK, and so it's really important to try and look at how that impacts on the mobility of service families. And we know there is a growing need for mental health support throughout our population and within the military, and there is stigma in accessing that. So what can we do about it? Well, it's been great to see what the work that's been done with veterans, and I was delighted to find this particular slogan, Armed Forces Veteran Family Accredited GP Practice. Wonderful. What we have recommended and is a priority is Armed Forces Service Family Friendly GP practices. My own practice asks if I've been a veteran. It doesn't ask if I'm a serving military family. And we need to get all the medical profession actually keyed up to understanding the needs of military families when they move. And that can be terribly important for dual serving families where the children register with a GP in the community while the parents are getting support from the military services. And that means that we have children who are orphans within GP practices. And we have said quite a lot about that in our report. So again, it's about better awareness, better understanding, a better emphasis on continuity of care and parity in waiting lists, and taking account of healthcare needs on posting so that we just don't disrupt people in the middle of very serious, maybe serious support for cancer treatment or whatever. And within this health and well-being sector, we need to understand loneliness and social isolation. So what do we do to support service families? And we found a lot of support. Out there, there's welfare support within the services. There are 400 plus charities offering support to service families. But it's pretty disconnected, and most families told us they didn't know what there is and where to find it and how to access it. Family and relationship stress was something that people talked about, but they didn't want to go to the chain of command to talk about that. People don't talk about loneliness and isolation. They feel embarrassed about having to confess that. And domestic abuse and intimate partner violence are obviously issues within the military, which are really difficult to talk about. So there are variations in welfare support through the 3 services, and there are barriers to help seeking. So what are the priorities? Well, better coordinated tri-service support is one of the priorities, so that whichever service you're in, you're going to get the same kind of level of support. We need much more proactive early intervention and specialist support for families, and increased awareness of the pressures so that we reach out and that we just don't wait for family members to report problems. We have to be out there finding ways to support them in a preventative way. Breaking down barriers to health seeking, a confidential helpline for children we've talked about, a much greater collaboration. And so again, there is a need for more joined up and a better experience of getting support. And then we moved on to looking at some research priorities, which Gabriela is going to just talk about.
So at the same time as collecting the evidence and analysing what the messages were coming from families themselves and from organisations working with families, we looked at the research and we undertook an international research review, because this military population face the same challenges, whether they're based their UK families or US families and so on and so forth. And we've identified several gaps in our understanding what the impact of military career is on family dynamics, for example, parenting and children, and family mental health and well-being. And I think we all recognise that these are the major areas in which, while there is research and more research is emerging, there is more need to understand those complexities better. In understanding research and what are the research priorities, we also need to refer to research standards. And the research needs to maintain and raise the standards in order to provide evidence to informed interventions. So research needs to be empirically and robust, and needs to be theoretically driven and theory generating in order to enable understanding of the complexities of military family life. Research needs to be relevant and impactful to lead to an impact to improve the lives of military families. And it needs to be interdisciplinary. It is very rare, and we understand these days that it is very rare for a specialist area to address all the complexities of, for example, child development or family life. And not least, research needs to be international. There needs to be greater collaboration amongst countries who are facing the same challenges in supporting this particular group of families. It's also very important that when we put together the knowledge, that we sort of bring the knowledge together in a synthesis, and we transfer this knowledge across areas of relevance and across geographical borders. And it's also important to understand, in terms of research priorities, the challenges that research faces. It is military families and military populations are a notoriously hard to reach research population, and we know that ethical clearance and the ethical approvals to even access this population from a research point of view can take a very long time. And also we need to be mindful that there are sensitivity around certain issues which research will want to address, particularly around stereotyping. And I'm just going to highlight some of the areas that were particularly addressed in the report in terms of research priorities. So one of the great research priorities around the service children, and we've already mentioned looking at children outcomes and particularly how their early family experiences will impact on later outcomes, on their academic choices and later on educational outcomes. And it is very important to stress that in addressing these questions and in understanding the children's outcomes, it is vital that we engage in longitudinal research. This is the bedrock of understanding child development and the impact of early experiences on later on development. And another interesting issue that comes out of research is when we try to compare the experiences of service children, what is the ideal or what would be the appropriate comparison group, considering the challenges that they are facing in comparison to non-service children. Another particular area that research needs to be addressed is understanding the young carers within the service families. and it's about understanding both their complex caring responsibilities and what kind of support they may need. Another area of research priority, as we already highlighted, is around understanding how best to support spouses and partners, as this is a key to supporting retention. And one area is around understanding the childcare provision and how the needs for this early childcare, what the needs for the early childcare are, and how these are impacting and how are they contributing to the spouses and partners' chances of employment. And we've come across various partner employment initiatives that were evaluated, and these are valuable in themselves, but it's very important that research engages robustly with understanding those initiatives in order to look at what their actual impact on retention is. A great research priority is around family mental health and well-being. And there is now a clear message that mental health issues can be triggered or influenced by military lifestyle and deployments, and this goes beyond the active service of the family member. And we now know from mental health research that mental health issues reverberate throughout the family. Therefore, it's very important to understand how mental health issues affect, for example, children and young people, or partners and spouses, and at the same time to understand the mutual relationship, how the other family members influence the mental health of the serving family member. And we've touched already on the issue of understanding the complex dynamics of intimate couple relationships in military families, particularly looking at issues of domestic violence and interpartner domestic violence. And this is a particular challenging area, both in terms of understanding domestic family violence in general. There are various complexities there, and particularly when we're looking at the military populations, when we have factors like mental health, like trauma, that could exacerbate those issues, and understanding this complex interplay between mental health and family violence, it's very important. As I said, in our review, we came across a variety of interventions.
I'm really sorry to interrupt. I'm conscious of time, and
okay. Thank you.
Whether or not you could wrap up in say a minute, just so that we can move on to the next presentation. Thank you.
Okay, right. So I think we've touched upon some of the issues around interventions and how important research evaluation of interventions could be to contribute to our understanding of the challenges of military families and how to better support them. And I think I'm going to just wrap up. Jan, I'm going to hand over to you to perhaps look at the overriding recommendation for change.
Thank you. That would be helpful. I happen to have lost my link, but I hope you can still hear me.
Yes.
Good. Okay. I just want to finish by saying one of the ways we think that the recommendations can be taken forward and our priorities mentioned is strengthening the Armed Forces Covenant. And we know that that's being legislated later this year, and we really believe that we can improve the support for service families if we do that. And we've made one overriding recommendation for change to the Prime Minister, and that is about spearheading a change of culture. And I think for Andrew, Gabriela and myself, one of the most important priorities for change is to try and find a better cultural fit for our armed service families, that they are respected, supported and valued within our community rather than hidden away. We've seen them more through the pandemic, and we really need to value the sacrifices they make, to say thank you for their service more often than we do, and to ensure that all families feel valued. Thank you very much indeed, and we look forward to working with people again in the future. Thank you.
Thank you both so much for that fascinating overview of the report, and I know it was a huge piece of work, and apologies for interrupting, but I know there's been some great comments and questions in the chat, and we can pick some of those up in the Q&A. So thank you for your time this morning. So at this point, I'd like to move on to our final presentation today, and this is from Helen Helliwell. Helen is Director of Armed Forces People Policy, and a post that she's held since February 2019. In Helen's bio, she covered all the sort of portfolio or policy areas that she covers. Well, I think I'd be here till next week if I went through all of them, but suffice to say, Helen's got a huge portfolio with some topics that I know will be of interest to individuals here today. So health, well-being, accommodation, pay, everything. So I think Helen seems to cover the breadth of all aspects of life within the armed forces. So very busy. So grateful for you taking the opportunity, or taking time out of your day and giving us the opportunity to hear from you. So Helen, over to you. Thank you.
Thanks very much, Nicola. Can I just do a sound check? Can you hear me okay?
Yep, perfect.
Fab, thank you. Well, I'm sorry that I haven't got any slides, so I'm sorry that you're just going to see a picture of me up on the screen whilst I talk, but really grateful for the invite from King's to again come and speak to this conference, and fantastic that you've got so many fantastic questions coming through on the Q&A side, so I'm really keen to leave some time for that too. So as you said, I'm going to focus on families today. I'll respond to Jan's presentation and talk about what the department will do next. I then thought I'd spend a bit of time talking about the defence context that we're working in now and what's been different this time for us working with COVID, and what we've done importantly to support families, and what's coming next. So a huge thank you to Jan and to Gabriela for their presentation and just the very collaborative, collegiate way that they worked with the teams, not just in defence, but across government, actually, in producing their report. 110 recommendations, so very, very thorough. 75 of those are for MOD, are defence focused, but the rest cover other areas of government. Of those 110 recommendations, we agreed to 87 of them completely and in full, 20 in part, and 3 we haven't accepted the recommendations for. That doesn't mean because we don't recognise that there's an issue, but perhaps that we think there's a different way we might be able to address that particular area of concern. So the teams have been working to draft the response to that report, which will be published. Because it's a cross-government one, it's not only our ministers that need to sign up to it, but ministers and other government departments too. There are just 2 outstanding responses we're waiting for, so I won't name them, but there's just 2 ministers we're waiting to hear back from in other government departments, with the aim that we'll be publishing our response to that report by the end of this month. So we're aiming for the 29th of March, I think. So the team are very much working on that. And then really importantly, it's what next? What do we do with that report? So the team have also been busy working on the next iteration of the family strategy, which again is a cross-government strategy, and which the teams have taken all of those recommendations and also a lot of some of the other work that we've learned from the previous strategy to have a much more refresh strategy encompassing all of Jan's work. Again, that's out for review across government next month. And then we have a ministerial meeting with the family federations towards the end of April. So at that time, that's when we'll get sort of our own family feds and ministerial sign off to the wider family strategy, with the aim for it to go across government for right round in June and published thereafter. So the response to Jan's report will be coming out at the end of this month, and then our wider strategy will be published sort of June, July time. So turning then to families, and particularly the aim of what you've asked me to speak to today, we know that we put a lot of responsibility on families to ensure that serving people are ready to deploy wherever and on whatever task that may be asked of them. And of course, there are many dual serving families and partners of serving personnel who have their own demanding careers of their own, which clearly brings added complexity to family life. And I think more on that later. Defence have been involved in 2 main operations to support COVID. You'll be probably familiar with the terms now, but OpRescript is the name of the military operations in support of COVID in the UK. It's the biggest military operation in the homeland in peacetime. and this time very much in a supporting role to the NHS and other government departments and local authorities. You'll be familiar with the vaccine distribution and administration, testing, protective equipment logistics, building of the Nightingale hospitals, research, and also actually helping other departments plan too, but again, all very much in supporting roles. And then our broad share is the UK military response to COVID support in overseas locations. So be that repatriation flights or evacuation flights, delivery of vaccinations and protective equipment to overseas locations. So two main focuses there. But of course, we've also been maintaining all the other critical defence tasks and operations. So whilst we've been focusing on those in the UK and those have been very much in the media, the armed forces have also been deployed on some 40 operations in over 40 countries in the world during the last year. So what's been different this time? Well, I think it really depends on your family makeup. You know, have you got young children? Have you got older children? Have you got care and responsibilities? Have you got people who are perhaps clinically vulnerable? Are you looking after elderly parents? And this time also, what is the role of the serving person's partner if they have one? And what kind of accommodation they're in. So there isn't really a generic, this has been the experience of armed forces families, because I think, like with the rest of us, it's really dependent on our own circumstances. But this operation and this has been different. We've been in it together, we've been fighting it together, we've been suffering loss together, and we've been watching it daily on the TV. And we've all been exposed to risk, but no more so than key workers. And obviously this time it's not just the armed forces that are seen as key workers, it's very much been NHS, but also actually much wider. It's teachers, it's the postal workers, it's journalists, it's utility workers, some civil servants and those in the transport sector. So actually we found this time that perhaps our serving person is often married to a key worker that might be in a more critical role than they have. And that's brought unique challenge, I think, particularly where caring responsibilities are involved. And also when we haven't been able to rely on our usual support networks, when schools have been closed or when children's nurseries were closed, or we weren't able to go and see families and friends and rely on that wider network which we might normally turn to. And of course we've have a huge presence overseas, and there's been different overseas travel restrictions, either going out from the UK or coming back into the UK, and even changes in different kind of restrictions within and across the UK through the devolved administrations, and of course that continues today and will do for months. So we've had to adapt and be really, really flexible, and we need to continue to do that as the changes in government rules come through over the next few weeks and months, as set out in the roadmap. We've done a lot more on communications this time round. My boss, Chief of Defence Personnel, wrote to families via the family federations and via the chain of command back in March last year, setting out the changes that we were making, particularly around allowances and entitlements to make them much more flexible to respond to the pandemic. We've been working with BFPS to host a number of calls and kind of panel sessions to help inform our families as well, and obviously through the chain of command. But thank you to the family federations who we use as a way of communicating, putting information up on their website. Of course we put it up on .gov.uk too, and through various apps. It's all of our changes have been published on the Defence Net, and for those who use them, the My Navy app and the My Army app, etc. So you don't have to be plugged into an MOD system to see all of those changes. The way that we communicate change has been through something called the Defence Advisory Note system. So all the kind of changes to allowances, everything from continued education allowance for those with children in boarding school, to the daily food allowances, to get you home, to school visits, to be able to stay in accommodation from longer than you would normally be entitled to. All that kind of flexibility has been kind of promulgated through those policy changes. And then we've looked particularly at our overseas cohort and families, extending personnel exemptions from border restrictions for those needing to travel for personal resilience reasons, for example. So not just those involved in key defence operating tasks, but if you need to travel to get back for your own mental well-being, we've ensured that those are enshrined in the government guidance too. And of course, any additional cost to testings, etc., are being picked up if you're coming back from overseas. We did also cease all but essential postings for a period of time as well. So unless you were absolutely involved in the COVID response or critical defence operations, we tried to really limit how many people were being moved during the height of COVID. There's quite a lot that we've done to promulgate guidance with serving people and hopefully then through their families on health and well-being, whether that's through diet and nutrition and releasing some different kind of cookbooks to support for bereavement, how you need to keep fit during lockdown, mental fitness and resilience. We brought forward the release of HeadFit, as you're aware, to support serving people, but also because it's on open platform, it's available for families too. And we work really closely with the NHS and FAMFEDs and Hives on domestic abuse, alluded to earlier, and I saw a few questions in the chat about it. We know that, like in the non-armed forces and civilian society, domestic abuse has sadly increased during the lockdown period. So we put in specific things in place as well, whether that's providing safe spaces in terms of accommodation, safe space online through Defence Connect, etc. So a range of things that we've been doing on domestic abuse too. And then just like, you know, a lot of the charity sector, we've moved a lot of our support online, particularly through partner career support. We know that's been just as important through COVID. So whether it's through Ex-Forces Enterprise, RBL LifeWorks, there's a huge plethora of support that we get from FAMFEDs and other CICs or charities on partner support. The military co-working hubs, for example, providing supportive communities, and our own partner career support programme through the Career Transition Partnership, which has all been around career coaching, personal development plans, helping with online assessments and CV guidance. So that all moved online during COVID too. And of course, childcare was mentioned previously. Obviously, we've started our pilots for the wraparound childcare to give free childcare for those families who have children in the 4 to 11 year age bracket. So this is breakfast clubs and after school clubs, really. We're piloting it in 4 areas at the moment: High Wycombe and RF Halton, Catterick and Plymouth. And the Secretary of State is very keen that we go live across the estate from the end of this year. The pilot is really looking at the best way to administer it. It's looking at things like tax treatment, and it's working with those local areas to make sure that they've got provision. As some, I think it was in this Q&A chat that some people saying our school just doesn't offer it. So we're obviously working with local authorities to ensure that the provision is there for people to use. We've also done quite a bit on financial support, a lot of signposting, I think, for financial support, particularly where serving people may have a partner that's lost their employment. And compassionate leave, of course, so where you haven't been able to have childcare or your child isn't at school and you can't work from home because of the type of role that you do, then compassionate leave doesn't count against your holiday entitlement. You're still paid, but it's acknowledged that you just won't be able to work during that period. We've also been supporting the charity sector for an extra £6 million worth of money specifically for COVID related support, which we administered through the Armed Forces Covenant Trust Fund last year, because we know obviously that the charity sector has been hit badly without being able to do their normal fundraising activities. But also I think we need to acknowledge, or it's good to acknowledge, that there have been some advantages. I was speaking to some serving personnel. I said, this is the longest I've ever spent for some time with my partner and children, because normally they are away from home Monday to Friday, or maybe they are deployed. But actually for those who were weekly commuting, particularly in office jobs, and they're able to now work from home, that's been a real benefit for them. And I think for those office workers where we've now enabled working from home through the IT that they can have, I think it will be, I don't think people want to come back to working 5 days in the office again. I do think that we will look at a much more of a hybrid model where perhaps people are working 2 or 3 days in the office and then benefiting from working from home. We know it doesn't suit everybody, people in shared housing, people who have patchy Wi-Fi. I suspect we've all had emotional moments with our own IT during lockdown. But obviously working from home when the children are at school is very different to working from home and juggling childcare and juggling homeschooling. And I think when the kids or the childcare is sorted, working from home, there's huge benefits of that, which we'll want to continue. But I think it has been a tough time for all families. But I think, as previous speakers alluded to, our families are really resilient. They're used to being really self-sufficient. And I think that puts them in good stead for coping with something like COVID in perhaps in a way that other families haven't used to. But it's also okay not to feel okay. I think we've all had emotional moments where it's just felt all a bit too much. We're all in demanding roles, and when you're coping with COVID, when you've got children or not, caring responsibilities, loved ones that you've lost, or people that you just haven't seen for many months or over a year now. So we've all been dealing with that. So I'm really conscious that I think it was, you said, Nicola, some 500 people had signed up to the conference, and I'd really like to hear. I haven't been monitoring the Q&A as I've been talking, but I'd really like to hear, and happy to answer any questions from the audience. Of course, we continue to review our policies as we move out of lockdown, but I think there's some really important lessons that we can learn about what has worked well, and we continue to do that. So back over to you, I think, but a huge thank you to all the family members that might be listening to this call, enabling the armed forces to operate in the way that they do. Thank you.
Thank you, Helen, and thank you for a break from PowerPoint. So, and the detail that you gave us around the recommendations and when the government or the response will be to the Living in Our Shoes report. That's great. So thank you for sharing that. Yeah, we've had some great questions and comments in the chat. I'm going to start with one that's come in around what's the anticipated impact on the family if the change in the global operating footprint comes to life. I think that was as talked about in the integrated review.
Yeah, absolutely. Really good question. We are working now on the integrated IOPC. I can remember what the acronym is, Integrated Operational Concept for future operations, and how that will affect family and not just families, but serving personnel as well. So there was a section in there on people, and it's very much Chief of Defence Staff's priority to ensure we look at the impacts of that new operating model and what it will mean for families. It's something that we've talked about. I've had meetings with Secretary of State about it, and with Minister of Defence, People and Veterans, who's very keen that we work to look to mitigate any ill effects. It's interesting because that operating concept will potentially, we talk about being more forward deployed more of the time, and actually, when you think about some of the cyber stuff that we're doing, some of that will be based in the UK, so not always being overseas, but I know that there's a huge amount of international engagement as part of that strategy. So very much front and centre of people's minds to make sure that we are looking at that impact, and I think some announcements on the follow-ups to the IR will be coming out in the next couple of weeks.
Thanks, Helen. When you were talking, you mentioned communication with service families, and you talked about that as via the service person, and that's a challenge that as researchers we have had, because we have to go via the service person to get to the family. And I wondered if there was you had any thoughts on how we can facilitate communication to the families more effectively, so they, it's a bit like the note in the bottom of the school bag. It's only when you kind of go through the bag that you find the information. How can we facilitate communication with service families?
I think it's really tricky, and it's one that you and I have talked about before, because we do have to go through the serving person, and we have to be comfortable that we have their permission to communicate with the families, because some people say, no, this is my career, my family are busy doing something else, or my spouse might have another career, and not everybody associates their whole identity as a service family. And if you think about other employers, it's unusual for people to communicate direct with a family and not through the person that they employ. So I think we've got to be really careful about permission. We do always encourage serving personnel to keep contact details up to date, because obviously they may not live in the same place as where their family does, but we do rely on them to keep that information up to date on where their family can be, and that they're happy for us to communicate with, which is why we've been taking advantage of the family federations and their support in communicating these changes, putting information up on the website 3.gov.uk. But I think, yeah, it's just something that we need to continue to look at, and continue to explain why it's so important to the service person to make sure that they are enabling us to communicate with the family, but it's also about the family really communicating with the serving person too. And I know they don't always want to feel like they're putting pressure on or worrying them with concerns that they have. So through the chain of command, through hives, obviously another one that's really accessible to families. But if anybody's got any bright ideas out there about how we might be able to do things differently or more effectively, bearing in mind kind of the data protection, etc., that we need to be then very happy to listen.
Thank you. At this point, I'd like to invite the other presenters to join you on the panel, if that's all right with yourself and excuse me, with the other presenters, and we can continue with the Q&A. So I think we got everybody. Perfect. Great. Oh, thanks everyone. So I'm just going to ask some questions that came up earlier in the chat that we haven't had time to go through. I mean, there's so many questions, and unfortunately we won't have time to go through all of those. But maybe one of the questions that came up was around stigma and people coming forward, be they the veteran or the service person themselves, but also the families. And some of the comments in the chat were around, you know, there's lots of resources out there, and there are lots of places people can go to for help, but there's still this kind of reticence to do that. So I'll be interested in people's thoughts and how we can encourage people to come forward and access the help and support that's out there. I don't know who would like to go first. Dominic, as a working for combat stress.
I think I'm going to take a very different answer, which I might normally do, which is, well, maybe it's not. We could learn from some of our NHS colleagues. There's a fantastic trauma service in Edinburgh, run by Claire Fyfie, who really recognised the impact of stigma and the impact it was having on people actually just turning up to appointments. And so they moved their clinic out of a hospital and above a library. And, you know, it sounds simple, but actually, and they, you know, got lots of plants and stuff like this, but they found that by doing that, they, you know, normalized people's experiences of going for mental health difficulties. They felt less pressure on it, and actually it was more accessible in some ways because it was a, you know, a centre of a town rather than this hospital was a little bit further out. So I think actually, you know, there were some very practical things we could do around that to improve accessibility. I mean, I think I'm a big advocate for a lot of this remote access support, which I think could be very helpful as well, given the complexity where people live across the UK, to improve accessibility. And then I guess the other side is the trying to tackle stigma head on. A lot of work would suggest it's a lot of internalized stigma, so coming from ourselves rather than from other people. And actually, when you look at other populations, what seems to be effective is using role models, using lived experience. People with lived experience can be helpful, and clearly that's going to be applicable for this population as well. But there are a couple of my kind of thoughts off the top of my head.
Thanks, Dominic. Jan, did anything come out from the Living in Our Shoes report that may help us, particularly thinking about families?
I think one of the things that families talked to us about was peer support is really important. And that's much easier for families if they're living on or near a base and they've got other military families around them. But I think that what many people said was they would like people to reach out to them so that they don't have to make the first move. And I think this is where we've said things like teachers and health professionals, and everybody needs to be very well aware of the needs and experiences of military families so that they can reach out and ask the question and be there for them. And I know that welfare officers have a huge challenge in reaching families who are dispersed all over the country. And so the RAF have been building an app that every family member can have, which has got lots of information on it as to where to go, where to seek help and so on. They feel that's being very successful at the moment. Some local authorities are doing it. Surrey County Council have one for their military and so on. So I think there are ways of doing it through our media technology and so on that people can find where to go. But yes, it's very hard to have to admit that you want help, I think, for many, many of us, and particularly for people who are worried that it might get somebody into trouble if they say there's a problem. And I think normalising the fact that everybody has stresses and strains, and talking to the serving personnel about it's okay to have problems and it's okay for people to feel stressed at times, and normalising that and making it something that we can all talk about is really important in our society, because we tend to see it as something rather shameful, which is really very unfortunate.
Thanks, Jan. Another question that came up was around sort of in the past, research and policy was probably very much on that kind of traditional family. So, you know, the male being in the military, the stay-at-home spouse, they're married and they've got the kind of obligatory 2 children. How do we ensure moving forward that that research and policy are actually reflective of society as a whole? Helen, I don't know whether you want to say anything from MOD perspective.
Yeah, it's a really good point, and one that we're really conscious of. And I think when we commission research, we need to make sure that we are tackling perhaps the maybe seen as underrepresented groups. We've certainly just done that recently through the suicide work that we've just funded, the One Is Too Many campaign through the Covenant Trust Fund, and the Positive Pathways work that we've been doing. We've particularly been asking grant recipients to particularly target those underrepresented groups, whether it's LGBT community, whether it's those of certain faiths, whether it's single parents, dual serving couples, etc., etc. So really conscious of it. Great question, and keep holding our feet to the fire on making sure our policies do reflect the diversity in the workforce. Really great that we've now got a new directorate set up within Defence People, which is now being headed up by Sam DeForge, a fellow director, focusing solely on diversity inclusion within the armed forces. So I think that will give more resource, more attention, and her working with us as part of our leadership team will ensure that all the kind of big policies and strategies that we're coming out with have diversity inclusion running as a core throughout them, so that we are making sure that we represent the people within our workforce and the communities that we serve.
Thanks, Helen. Gabriela or Marie Louise, from a research perspective.
Yes, I just wanted to sort of add a point around stigma and ensuring diversity. And I think it's so easy to get carried away and talk about the challenges and the negative impacts of military career and the military life, family life. And it's important to understand and to balance that and to look at the strengths of these people and the resilience, particularly when we talk to children. And there is an element of stigma for service children as well. And it's important that we address this both in terms of research and in terms of how we relate to them, in acknowledging the strengths and the positive that comes out of these particular challenging life circumstances. And we need to remember that that's what resilience is. Resilience is demonstrated in face of adversity, and it's to acknowledge and to balance that both in research and in way that we relate to children and to military families.
Thank you, Gabriela. Marie Louise, anything to add on the research point?
Oh, yeah, I think that was a great point by Gabriela. And just that in our own research, our own families research at KCMHR, we kind of know that families come in all shapes and sizes, and we have, we set up our research specifically for blended families and families that look different as well. And so I think that's just something into the future, that the way that we set up our research and who we might need to speak to just takes into account that, there's so many different types of families, and they are all, within the armed forces families and communities as well. So, yeah.
Thank you. I think one comment, Jan, I think you mentioned it in your presentation, was that these families were feeling invisible, and I'd wonder, how can we improve that? So we've talked about, ensuring that they can access that MOD can communicate with them, and about accessing care and the support that they need. But how can we improve their visibility to the wider general population.
I mean, I think that comes back to our famous recommendation to the Prime Minister about a shift in our culture and valuing our military rather more than we have done in the past. I mean, I think it's going to be an increasing issue with more and more families going to buy their own accommodation or find their own accommodation, no longer necessarily living on or near a military base, and therefore part of the community. And we spoke to a number of partners and families who were in that position, who said that as soon as they said to people near them that their partner was in the military, there was a bit of a shutdown and whatever, and really, and then some comments which were probably a bit negative about that, because not everybody supports the military, and also your partner goes away and fights, does he? You know, that sort of thing. And so people were very anxious about not necessarily saying who they were. We had several mothers tell us they would never, ever hang military washing on a line in the garden, because that would just give everything away, so they wouldn't do that. And children had been told not to tell their friends what a parent did and so on, or why their parents were away. Now, you know, hopefully these are isolated examples, but they happen. And I think there is, again, just a lack of understanding and a lack of knowledge in our society about what the military does. It doesn't just fight, and you know, it's keeping us safe, and we need our military to keep our country safe, to keep all of us safe. And I'm hoping that actually, having seen them more visibly during the pandemic, that there might be a different kind of understanding of just how important they are for us and what their families experience as a result. So I just think it's a slow thing. We have to keep changing, but we must do something about it. Armed Forces Weeks, let's have more visibility of Armed Forces Days. Let's make it so that it's really a real event for the country.
Thanks, Jen, and I think some great ideas there that we can perhaps all try and move forward together. I'm conscious of time, and I know that everyone's taken a couple of hours out of their day to be part of this. So there have been loads of questions, and I'd like to thank the audience for all of those questions, and apologies for not being able to get through them all. But thank you for your engagement today. I'd like to thank the presenters. Thank you all for the great presentations, for sharing all the information that you have with us. It's been fascinating to hear. I'm really looking forward to finding out where are we next year? So what has been that longer term impact on the veteran community that Dominic and Marie Louise talked about with COVID, but also how have the recommendations from Jan and Gabriela's report been taken forward, and are families seeing and feeling the benefits of that? So I think watch this space, and hopefully we'll have some great positive outcomes to report this time next year. So thank you all, and thank you for contributing to the Q&A sessions as well. I'd also like to thank Steve Rice for his really insightful and honest video that he provided at the beginning. I know that Steve is part of the audience today, so thank you, Steve, for that. We really appreciate you doing that and sharing that with us. I'd like to thank you all for attending, and just to give you a shout out for next week's conference, which is on substance misuse and gambling. So that's Thursday the 25th, same time, same place. And I'd like to thank Forces in Mind Trust for sponsoring the event, and also the KCL team that I can see on my screen but the rest of you can't, who have kind of helped, have basically supported and pulled this event together. So I'd like to thank them and recognise the support that they've provided. And just thank you all, have a great day, and hopefully see you all next week. Thank you.